because I'm a member of 4 labor unions, and when I was running for the Senate, I got my health care from the American Federation of TV and Radio Artists and from the Writers Guild of America. I got my prescription drugs from the WGA. So I know how important, and I've walked picket lines, I know how important labor is. And that's why when I got into the Senate, and I got in a little late, but I didn't get in too late. Let me tell you that. And the first thing I did on the first day I was there was I signed on to EFCO, the Employee Free Choice Act. And I'll be fighting for that. I've only been in the Senate for about 2 months, and about a month of that has been this recess. But during the recess, I didn't waste any time. I've been all around the state, talking to people, been at factories, been at hospitals, been at schools, talking to healthcare professionals, talking to labor, talking to everybody. And I tell you one thing, people want healthcare reform. They want it. And we had a lot of disinformation spread this August, and it seems like that's all they can do. They don't want to help with healthcare reform, but they do seem to spread disinformation that engenders fear, and we're not going to stand for that. You heard about the death panels. They even sent a letter, the Republican Party sent a letter to Republicans saying that the health care bill said that the government would look at your voter registration before they decided whether to give you surgery, and if you're a Republican, they wouldn't give it to you. This is how ridiculous this is. And this is a very complex part of our economy. And it's good to have legitimate debate. But you can't have legitimate debate when people are deliberately spreading disinformation and when they're trying to make people afraid. And we're not going to let that happen. In fact, I think it's going to backfire on them, frankly. So I'm really glad to be from Minnesota, be a senator from Minnesota, because in Minnesota we have a lot of smart people who have been working on health care for a long time. And we do it better here than, we're in the top quartile. We're actually either 1 or 2 in healthcare outcomes, and we do it for less money than they do it elsewhere in the country. So I am going to be on the floor of the Senate. I'm going to be fighting for the kinds of things that we do here in Minnesota. Minnesota has all non-profit insurance. Did you know that? 91 cents out of every dollar that goes to health care in Minnesota, or goes to health insurance, goes to health care. The rest of the country is 70 to 80 cents. Now, we're going to do things the way we do it in Minnesota. If we did everything the way we did in Minnesota, we'd pay for this thing. And we'd pay for it like that. And I'm going to go and fight for the public option. We got to do it to make the private insurance companies compete. They've had years to make themselves more efficient and to change the way we deliver and pay for health care, to reward preventive care, to reward the kind of things that keep costs down. They just haven't done it. So we're going to have to do it for them and teach them how to do it. Then they'll learn, and then we'll do it, and health care will come down. Because what we're doing now simply isn't sustainable. So I got there a little late, but it's not too late. I got to take part in the Sotomayor hearings. I got to explain to some of my colleagues on the Judiciary Committee that the kind of judicial activism that we've seen over the last 10 years or so has been conservative judicial activism, not liberal judicial activism, and change the debate on that. And I'm going to help change the debate on health care and put the focus on what we can do to make sure that everyone has affordable health care that they have access to. And we'll do it in a way that'll bring the cost down. And yeah, it may bring the profits down of some insurance companies. But what it'll do is make us a more competitive country. You know, I mean, obviously there's a moral issue here, and that is that everybody gets care. Right. But there's an economic issue here too, because we cannot sustain this. Every other industrialized country provides universal health care, covers everyone. Every other country, developed country, provides universal health care, gets better outcomes than we do, and does it for about half the cost. We're no dumber than the rest of the developed world. We can do this. We will do this. And I will fight with every ounce that I have in my body. Thank you very much.